Hi, today I'm going to be going over information from Chapter 18 of your textbook regarding evaluating randomized clinical trials. Critical evaluation of clinical trials is very, very important because many treatment decisions are based on evidence from randomized controlled trials. So poor study design and methodology may produce misleading results. And just because a randomized clinical trial is published in a peer-reviewed journal does not mean that it automatically is a good study design and used the best methodology and had the best outcome measures. It's up to us as readers and clinicians that we should be able to evaluate the impact of flaws in study designs on results for translation to patient care. Very rarely, if ever, is there a perfect study design or a study that's conducted. There's always going to be some limitations as well as strengths, and it's our duty to be able to identify that and kind of weigh the benefits and the limitations of a study. Okay, so there's a variety of different criteria that we can use for evaluating and reporting clinical trials. So there is the consort statement, which is probably the most well-known, is a standardized report, includes standardized reporting requirements. And there's an example of the checklist in your textbook in table 18-1, so you can take a look at that. There's different types of quality assessment scales, which has been covered also in your textbook. And then there's also different types of benefits and limitations of the scales and reporting requirements. They all kind of vary in what they include and how they rate things and the number of points you might get for a particular scale. So it's important to kind of keep that in mind. So validity is particularly important because this is the degree to which a measurement truly assesses what it's intended to measure. So there's two major types of validity, and you've heard this several times throughout the semester. The first being internal validity. And this means that the study is designed and conducted in an appropriate manner so as to arrive at accurate results. Factors if conducted poorly that might lead to decreased internal validity include poor randomization, measurement and assessment of variables, dropouts, and overall methodology. The second type of validity is external validity, which means that the results of the study are able to be accurately generalized to the larger population. And so factors if conducted poorly that might lead to decreased external validity include recruitment and selection of participants, inclusion and exclusion criteria, sample size, and setting. So when critically evaluating randomized controlled trials, there's a variety of different things that you should be looking for and types of questions you should be asking. So some of these areas involve, first starting off with study sample here. So looking at the recruitment strategies, what the inclusion and exclusion criteria are. Do they include sample size calculations? What are the baseline characteristics of the study population? So are the inclusion criteria actually representative of the larger patient population that this would apply to? Are the exclusion criteria so restrictive that it's not going to be realistic? Did they include sample size calculation? Because you want to make sure that they're adequately powered to detect significant effects. And the second is this randomization and blinding. So do they define what kind of randomization methodology they use? Like, do they say blocked randomization, stratification? Do they tell you how allocation was created, and is there blinding and who is blinded in the trial? All of this should be described. Look at the intervention and control groups. So is an appropriate comparator used? And this is essential. Treatment adherence should also be assessed. Clinical endpoints need to be defined. Are they using validated instruments? Are they basing their endpoints on objective or subjective measures? Is there surrogate outcomes and composite endpoints? You got to look at the trial findings. So are they using an intention to treat analysis versus a per protocol analysis? The results should be reported for all outcomes measured. Adverse effects should be reported. Measures of variance, including the standard deviation and confidence intervals, are ideally reported in addition to p-values, so you can get an idea of the magnitude of the effect and everything. Is there a predefined treatment effect size? And are they making appropriate conclusions based on the methodology? And then lastly, we need to consider the limitations and implications. So we need to weigh the potential degree of bias in a study with the ability to generalize the results. When applying this to clinical practice, there's a couple things that we should be thinking about. So first, what is currently known related to this topic? What does the study add that was previously unknown or unclear? What questions remain? And how do these results translate to specific patient care? You should always be thinking about this when you read a study and you're thinking about how it might apply to your patients. An application to specific patient care. So calculating absolute risk reduction rather than the relative risk reduction, because the absolute risk reduction takes into account the incidence of events, whereas relative risk reduction does not. And calculating the number needed to treat if appropriate. Compare the patient to those in the study. Does your patient match similar baseline characteristics as those included? Weigh the benefits and risks of therapy. And consider patient concerns and beliefs. Remember, this goes back to our very first lecture on evidence-based medicine and patient-centered care. And then factor the cost of treatment, monitoring, adverse events, and acceptability of the treatment.